This is a wake-up call. Global health needs to be prepared. In a context of so much pain in so many communities around the world, health, economic, and political actors across the globe are making the case for equitable cooperation and multilateralism as the only means we can assure the reconstruction and well-being of our societies. We the peoples resounds louder than ever as a call to work collectively for true solutions, for joint actions, which will selflessly allow us to rebuild a world where the right to health is universally safeguarded.
The possibility of safe, effective, and affordable diagnostics, therapeutics, and vaccines provides vital hope of overcoming COVID-19. But unless such medical tools are fully accessible to all on an equitable basis, the world remains at risk. Unequal responses to the pandemic will widen inequalities, already exacerbated by the impact of COVID-19.
From the beginning, we have insisted that these tools must be available equitably to all countries. Every day counts and every part of the world needs to be covered.
13% of the world's population have already secured more than half the supplies. We've been here before. Do I need to remind us of the 10 million lives needlessly lost to HIV and AIDS?
We must always keep in mind that this pandemic exposes deep inequalities between countries. Developing countries remain at risk of being left behind in terms of access to medication, vaccine, and health technologies.
Science is searching for solutions, but also to make the solutions work for everyone, we need the science to be shared.
We need to maximize supply. No single company can make enough vaccines for the world. We need to unlock huge manufacturing capacity for the vaccine.
COVID-19 technologies, more specifically the vaccine, should be a global public good and not to be commercialized.
Of course, we cannot separate the development of health technologies from intellectual property. At the same time, its noble goal to save human lives must take precedence. Flexibility in intellectual property rules, including TRIPS arrangement, is essential to produce affordable medications and vaccines.
Moving quickly means sharing data and information that may normally be kept secret or protected by intellectual property. Throwing off these constraints will accelerate the speed at which technologies are developed and avoid the duplication of research. In these extraordinary times, we're asking companies to take a step back from business as usual and consider the long-term benefits of cooperation. The longer the global economy is hobbled by COVID-19, the worse it is for everybody. Ensuring equitable access to vaccines, diagnostics, and therapeutics is therefore not just morally right, it's economically smart. The time to act is now. Decisions are already being taken on product development, licensing, and allocation that will impact the global research agenda.
Not only for this pandemic, but even for the next one. Vaccine nationalism is self-defeating. Even in rich countries, lives and economies will remain at risk as long as people in the whole world are unprotected.
I think that there were three messages that came out of this event. One is that we have a real political challenge. Vaccine nationalism is self-defeating, but we know that it is difficult for politicians to explain how actually cooperating is going to make their own population safer. The second is that we have a major challenge in supply. Not enough is being done. We have the institutions that would be able to expand supply if there was an agreement to share the know-how. And third, we still have a challenge in the mechanism to coordinate purchasing, of making sure that low-income countries are fully funded to participate in that mechanism.
We must work together to see our economies and humanity rise up from this crisis. We sink or swim together. The time has come for a people's vaccine.